Good day, everybody. My name is Dziwe, and I too am an echoing dream failure. I have the opportunity to introduce myself to Dr. Jacques. Dr. Jacques started an organization called Amani Global Courts, which is based on the island of Dziwe in Lake Kivu, which is on the Congolese side of the DRC-Rwanda border. Amani Global Works operates a community-led and driven health center that's really achieving remarkable results in one of the most challenging operational environments imaginable. By achieving these results, they're providing an antidote and really serving as a beacon of hope to a lot of surrounding communities in this plagued region. So as I was thinking about how to collect my thoughts this morning and succinctly summarize the great many wonderful attributes of Dr. Jacques, I thought about what Cheryl Dorsey said in terms of impact and performance evaluation really being best measured through persistence and effort. And if those metrics are the dominant paradigm, then there's no doubt in my mind that Dr. Jacques will change the world. Dr. Jacques is one of the most earnest and dedicated people I've ever met. I'm reminded of a story he told me about how in starting up this organization, Dr. Jacques would often sleep in the waiting room of the Dziwe airport on these hard chairs. And if any of you have ever been to Dziwe, you know just how spartan that place is. So I will let Dr. Jacques tell you more about himself and his work, but it's really a pleasure for me to be able to formally introduce him and present him with this shining rising star NGO award.
Thank you so much for making me feel like I'm, in LA. I see many stars here. I would say one thing before I can say thank you. I would say I disagree with what people said here. Because we've been experiencing something different from hanging out with celebrities. And Makila knows what I'm talking about, and Barry. For us, it has been a blessing to have Mandela coming to Dziwe, and since then he's gotten involved himself, really from his heart. So he didn't plan for this. He just said, okay, Jacques, I want to come and see, and just see how it's like to be there. He showed up, he got caught by the fire, came back, organized the fundraising, encouraged by Barry and the Segal Family Foundation. So I think I have a different experience, so I disagree on that part. But for the rest of everything, I agree, actually. So can you allow me to call my wife, Mimi? I'm here, and I'll tell you what. First, I would like to say thank you to Mimi. She knew that I had deadlines. In September 2011, we were about to shut down everything we've been doing for 7 years. We've been self-funding, so everything we saved was almost done. And she has never said a word. And she works with Dr. Dziwe at Columbia University Medical Center, and just told Dziwe, no, we run something in Dziwe, and we're looking for people who can help us because we can't do this anymore. And she encouraged me to tell people in the community that we can continue doing what we're doing. The community did not only gather everything they could to put together $1,500. It was a huge thing for this community, but they also came. They said we will never wait for people to give us money to do what we are supposed to do. They gathered everything they could, stones, cut sticks. We are very proud of this. When we come to Dziwe and Matt Dylan saw that, I think we consider ourselves as a Columbia, Harvard, medical center in that region. Our inpatient ward is in mud. People sleep on mud, but everybody is proud because they've done that, and I'm very proud. And since then, I said I will not abandon you. Dziwe took this seriously and said, Jacques, I'm going to do that, and introduced us and sent an email to Andy. Surprisingly, they immediately responded. We met. I wasn't expecting anything, and immediately they said, okay, we'll help you. So we've been alive. We do everything we can now because of Dziwe, Andy, Barry, Martin, Antoine, and everybody. One thing I want to tell Barry and Dolly, thank you so much for giving us this. This is my third chance in my life. I had the first one when I was born, the second one when I survived the war in 1996 and made it. My friends, my cousin didn't make it, I made it. We did this. I told my wife, Mimi, that this is my passion, this is my life. I'm not comfortable doing anything else. So I quit my job, I quit everything to just focus on this. And Segal Family Foundation has given me the chance to pursue this. And as Sherry mentioned that it's very good to invest in people. I'm usually shy in taking credits, but now that after meeting Andy in Nairobi, Andy has been approaching, you need to take credits, man. You need to take credits. So I take this credit and I'm very happy to officially announce that we will have a full-time physician in Iju Island. With 250,000, 4-5 doctors, that's not enough. So what Segal is doing, adding one extra doctor in Iju Island for 250,000 is equivalent of adding 1,000 doctors elsewhere. This is huge. In 2010, we conducted a survey with Harvard, and we found out everything is in the superlative. The highest mortality, maternal mortality rate. Nothing compared to what you're seeing in Iju. The highest child mortality rate. The highest fertility rate. I myself from Iju come from a family of 16, so we are a small family compared to the rest of people in the island. One mother, one father, 16. We are nothing. So what you are doing, just helping the doctor to be there, supporting these nurses, and helping me to pursue this, it's more than you can imagine. We always discuss at home with our children and our friends. Why don't we build on the strength that this island has? Peace in the middle of, you had the genocide in 1994. You have a war that's been going on for 20 years in this. And in the middle of this peaceful island, how come nobody talks about that? Even in DRC, I meet the governor, I meet some ministers, and I tell them, why don't you invest here? They all say, why? Can anything good come out of Egypt? I'm committed. I'm very proud of my passion for Egypt to be an example for the Eastern DRC region. And I know, and I feel it, and since with this star, so I'm going to take it literally, the way you describe it. I'm going to be that star, not that star on TV, but that star I'm going to rise the highest possible and just bring this message of hope. And I would like Mimi to say something. We have 4 children. She works full time. She wins the bread, and I spend.
Thank you so much. I will speak not really my forte. As Jacques said, Madigan was caught by the fire. Jacques is a very passionate guy, as you can also see, and I'm very proud to be part of his life. He came up with the idea of going back to Iju at a very critical time in our lives. He decided to quit his job, and I first found that being a crazy decision. When he came back after his first trip from Iju, after quitting his job, he came back with stories and passion, and the passion has always been there. There must be a reason. So I said to myself, I need to go back again and see what's there that's made him give up on everything to focus 100% on the work in the Ijwi. So we went back together. Pregnant women who had to work mountains hours in order for them to reach a clinic where they could get care, where they could be able to deliver in a safer environment. And most of them did not make it. I saw this woman who came to see Jacques as a physician when he was there because she lost 2 children. She could not get the care that she needed. And she was pregnant again and wanted to make sure she would be able to save this child. And he was all that she needed. And he had nothing but his 2 hands and his brain. And from that moment on, I said to myself, even if it's hard, but at least I know my kids are safe, they can get the care that they need. But he is everything for thousands of women and children on that island. They have nothing else but him, his 2 hands and his brain. We did not have any infrastructure, so he was just providing care with, this was all. And this little all was everything to them. So I said to myself, we have to do everything we can to keep going. We've been able to keep going for about 2 years, and we reached a point that we could not sustain it anymore. It was just impossible with my little salary to sustain our family and sustain his work in Ijwi. And we were at that point when I shared our struggle with Dziwe. And God bless you, man. He, right away, I feel he understood without even me having to explain too much. He was like, oh man, you are doing a great job. You are doing a great job. And right away he introduced us to the Segal family, and we were able to keep our work going. Actually, it's growing. We have a clinic where full staff nurses. Now we have a full-time physician, and it's just such a hope on the island if anyone has a chance. And see the hope and joy, the life that is back again on that side of the island. It's just amazing, and I just say thank you so much, and I'm so proud of you, Jacques.